I am Dr. Anita Krishnan, your airway allergy expert at Bangalore ENT Care Centre, Koramangala. Many patients who suffer from continuous sneezing, runny nose, itching in the eyes, frequent colds, nose block ask me, how do I identify the cause? What could be causing this problem? So that is where the allergy tests come in place. The skin prick test is a highly sensitive and specific and very easy to perform test, which can be done in the clinic. In the skin prick test, we place small amounts of antigen, which is the Pollen, Dander, house dust mite solutions on the skin, either on the forearm or on the back. This solution is gently pricked under the skin and allowed to remain there for 15 minutes. After 15 minutes, we see what is the reaction which has happened after this prick. People who are sensitized to these antigens will show a raise of the skin or a little tiny bump, which is called a wheal, or redness, which we call erythema. Then we measure it to understand how much the person is sensitized and is it really significant to treat this patient for that particular antigen. The test is well tolerated and it is quick. Most patients say that it felt just like even less than a mosquito bite. Remember, the sneezing, the runny nose, the itching, it is just the tip of the iceberg. The real problem is the allergy. Just like an iceberg, if we do not find what lies beneath, this could end up in comorbidities like sinusitis, polyposis, which is basically overgrowths in the nose, asthma, repeated ear infections, secretory otitis media or fluid in the ear. A whole cohort of comorbidities exist with allergic rhinitis. So it is very important to meet an allergy specialist or meet an ENT surgeon trained in allergy to find out what is the root cause if you have persisting problems. Thank you for watching.